Pediatric nursing, a vital role in child healthcare. Pediatric nursing is a specialized field of nursing focused on the care of infants, children, and adolescents. Pediatric nurses play a crucial role in ensuring the health and well-being of young patients by providing medical care, emotional support, and health education. Their work extends beyond hospitals to clinics, schools, and community health centers, making them an integral part of the healthcare system. Roles and responsibilities of a pediatric nurse. Pediatric nurses perform a wide range of duties tailored to the unique needs of children. Some of their primary responsibilities include 1. Providing direct patient care. Pediatric nurses monitor vital signs, administer medications, and assist with medical procedures. They ensure that children receive proper treatment while keeping them comfortable and reassured. Since children may not always be able to express their symptoms clearly, pediatric nurses must be skilled in assessing their condition through observation and interaction. 2. Health education and parental guidance. Educating parents and caregivers about child health, nutrition, vaccinations, and disease prevention is a key part of a pediatric nurse's role. They provide guidance on managing common childhood illnesses, injuries, and developmental milestones to ensure children grow up healthy. 3. Supporting emotional and psychological well-being. Pediatric nurses create a friendly and comforting environment for young patients who may feel scared or anxious about medical procedures. They use age-appropriate communication techniques, distraction methods, and play therapy to ease children's fears and make their healthcare experience less stressful. 4. Assisting in medical procedures and treatments. Pediatric nurses assist doctors in various medical procedures, such as administering injections, inserting IV lines, or dressing wounds. They also work in neonatal and pediatric intensive care units, NICU and PICU, to provide specialized care for critically ill infants and children. 5. Advocating for child patients. Since children cannot always advocate for themselves, pediatric nurses act as their voice, ensuring they receive the best possible care. They collaborate with doctors, therapists, and social workers to create a comprehensive healthcare plan that meets the child's needs. Skills required for pediatric nursing. To excel in pediatric nursing, professionals must possess a combination of medical knowledge and soft skills, including strong communication skills. Pediatric nurses must effectively communicate with children and their families, using simple language and reassuring tones. Patience and compassion. Caring for children requires a high level of empathy, as young patients can be fearful or uncooperative. Critical thinking and problem-solving. Nurses must quickly assess symptoms, make decisions, and adapt treatment plans based on a child's changing condition. Attention to detail. Children's health conditions can change rapidly, requiring close monitoring and timely intervention. Importance of pediatric nurses in healthcare. Pediatric nurses play a crucial role in shaping the future of healthcare by ensuring children receive quality medical attention from an early age. Their work helps in early disease detection, prevention, and treatment, leading to healthier lives for children as they grow. By providing compassionate care, educating families, and advocating for children's health, pediatric nurses contribute significantly to public health and medical advancements. In conclusion, pediatric nursing is a fulfilling and essential profession that combines medical expertise with kindness and patience. It requires specialized skills to care for young patients, making it one of the most rewarding careers in the healthcare industry.